Okay, so welcome everybody. People are still filtering in, but I'll get going. So my name is Dr. Dane Happany. I'm a physical therapist in Corvallis with Healing Motion Physical Therapy. And today I'm going to talk about hurt versus harm. As a physical therapist, I'm kind of an expert in pain and movement. And so I just kind of want to share what I've learned over time with you all. So I'm going to be talking to y'all about hurt versus harm. Basically, when is pain something serious and when is pain just pain? So overview. So I'm going to give you a little bit about me. How does pain work? The tissue injury healing process, when pain goes wrong and kind of the chronic pain cycle. What to do when you have pain. How to keep your joy in life greater than your pain. So basically, if you can't get rid of your pain, at least having more joy than pain taking that from you. And then how to reduce your risk for future pain injuries. I will preface up front that everyone's story is different. People ask me all the time, what about this? What about this? I always start with, well, it depends, and it is totally dependent to your situation. So there's nothing I should say tonight like that I would hope that you wouldn't take offense to, or hey, that's not true to me. You're probably right. It's probably not true to you. Everyone is different and independent. So with that, I'll keep moving. So about me. So I grew up down in Medford. I went to South Medford High School, played baseball and soccer, got my bachelor's at Oregon State. Through that was dating my high school sweetheart and ended up marrying her in grad school, my wife Tracy. Got my doctorate down at Chapman University down in Orange, California. And then had a really good church family down there, but had a really good opportunity to come back up here and practice. So started practicing in 2013 at another clinic in town. Since then, ended up doing my ortho residency, becoming an ortho specialist. Got my CrossFit Level 1 trainer certification to be able to just have better knowledge of strength. And then a year ago today, we had our first day open with me being the clinic operator at Healing Motion Physical Therapy in Corvallis. So Healing Motion has been in Philoma since 2005, but we now have a Corvallis clinic for the last year. And then I've got 3 kiddos in addition to my wife Tracy. She'd probably say we have 4 kiddos, including myself. So I've got Easton, he's almost 6, Ellery's 3.5, and then Lawson is 10 months old. So Healing Motion in Corvallis, feel free right now to pull out your phone and kind of follow us on social. Facebook's just Healing Motion PT Corvallis. The rest are just at Healing Motion. Also feel free to subscribe to our YouTube channel. We will continue to grow that with time. And our website's just healingmotionpt.com. So moving in, how does pain work? So really a lot of us with pain, you think, yeah, you put your foot in the fire, it hurts your tissue, you have pain, right? And Rene Descartes described that in the 17th century. And basically it was as simple as pain equals tissue injury. So you step on the fire, you burn your foot, you have pain, your tissue's damaged, you have pain as a result, and eventually as your tissue heals, you don't have pain anymore. So it was that simple. Well, pain is actually more complex than that. So taking Rene's picture, we have to add a ton more to it than just his picture and just that initial pain. So I have another picture that I think shows this better. Essentially, pain is multifactorial. So how does pain work? It is a ton of stuff, right? So you have the initial kind of pain tissues that come in and pain injury, but then all of these other things can factor into pain. So as you can see with the yellow flags, those are all things that can kind of create stress in our life and kind of ramp up our brain and our pain sensation. And so yeah, we maybe had a tissue injury and there's real pain, you can see that at the bottom, but all of these factor in. I like to use the analogy of when we have pain, it's like we're in a boat that is sinking. And so in the boat, from my specialty as a physical therapist, the leaks in the boat, I usually describe as being things like, yeah, your calf is tight and that's putting stress there, or you're not strong enough in your glutes or your core to help control that area. But then it's almost like if our boat is in the storm and we have, all those things, right? Less sleep, all that raining in, it just really makes for a nasty pain situation. And we can actually address those. We can improve the calf mobility. We can improve our strength. But if we don't address these other things, we can still have significant pain. And so really, as we're addressing those things, the analogy I use is we're kind of finding and fixing the leaks, as well as getting our boat in an area that's less stormy. And so all of these factors play in. To simplify, I like to think of our 6 pillars of health. So for those, I adapted them from 4 pillars of health from a physician that kind of coined that. And his was just sleep, stress management, nutrition, exercise, and activities. And personally, I really feel like some form of faith, spirituality, mindfulness, and then our relationships really factor into those things as well. I do have a blog post on this on our website. You can check that out for more details. So normal pain response. This is what we're all used to, right? You step on the nail, it hurts you, it breaks your skin and maybe some other tissues, and you have pain. You can see that the alarm activities basically go up, and then in a normal pain situation, it heals. I have a perfect example of this. Earlier this week, I was opening a piece of mail, and I got a paper cut right between my second and my third finger. And it hurt really bad, just this little paper cut, right? And as time has gone, as I kind of spread my fingers, that would kind of spread it and hurt a little bit, but my body's laying down scar tissue, and it's a lot less painful 3 days later right now. And you can appreciate how strong our tissue is. Like, I can kind of try to spread that cut as far as I can, and it's not like I'm recutting my tissue. So it heals pretty well. Normal tissue injury, here it is. So within the first 0 to 24 hours, you have the initial blood clotting. That's the fancy word of hemostasis there. Then you have inflammation, right? It comes in. Now notice that inflammation, 1 to 6 days, right? How long do we say that we have a tendinitis in quotes for like 6 months, right? Now technically that proliferation phase would also be some inflammation coming in. That's 24 days. Now this is normal wound healing of skin. So it's kind of cut in half. It goes over the course of about 3 weeks. Normal tissue healing of, let's say, got a tear in your hamstring muscle or your rotator cuff is more like 6 weeks. So you kind of just double these timelines. But appreciate that in 3 to 6 weeks time, your body has laid down scar tissue and it heals. Think about any time you've cut your skin. How long has it taken more than 6 weeks to heal? It usually heals. So that's the same thing inside of our body. And just like you could take that scar and try to pry it apart with your fingers, and you can't, it stays scarred down. Same thing with it in our bodies, but we have pain longer than that. So what gives? And again, just to show that tissue injury is normal. I call it wrinkles on the inside. So this study was a systematic review. They looked at tons and tons of different studies that had imaged people's low backs that did not have low back pain. And these were the findings that the radiologist said. So look at that on the top line there. 20-year-olds that have no back pain, 37% of them on imaging would demonstrate degenerative disc disease. The easier one that I like to forward down is the disc bulge. 30% of 20-year-olds that don't have back pain have a disc bulge. Now imagine that you hurt your back as a 20-year-old and you go and you have leg pain and everything and it's super painful. It's like that knife stabbing. You go and you get an MRI. You got a disc bulge. Let's go in and cut that out. Well, you might have had a disc bulge before you had pain. And so anywho, that disc bulge could be contributing, but it might have already been there. And just like you had it before and didn't have pain, even though maybe it's contributing now, you can get rid of pain even though you don't get rid of your disc bulge. Also, disc bulges tend to regress naturally over the course of a few months to a year. That's a talk for a different day. So when pain goes wrong, so up in the top you see those 4 individuals, one of them's red. 25% of people have chronic pain. And as you can see, that alarm system goes off and there's still the picture of the normal calming back down, but then you see what happens when it gets elevated. Now what elevates it? All of those yellow flags and those rain clouds that you saw are all the things that can aggravate it, as well as maybe physically overdoing things for longer. I don't know if anyone's seen the movie Step Brothers, but in it they have a joke where they put a bunk bed together where they can get so many more activities done. That's when your alarm system goes down. And then obviously when you have less room, you don't have the bunk bed, you got less room for activities. And when you're in that room, it's very frustrating. You can see how it takes a lot less pressure on the tissue to create very real pain. And if nothing else, I want you all to know that when you have pain, it is very real. Sure, some of those yellow flags and rain clouds can be contributing, but it's very real pain. You put that same pain in anyone else, they're gonna feel the exact same thing. The alarm is really going off. The difference is that you put that same exact pressure onto someone else's tissue, they're not necessarily going to feel the same pain. They may feel less, they may feel more. Depends on the alarm system. The analogy I like to use with this is a house alarm system. So appreciate if someone broke into your house. You had an alarm. The alarm went off. It's going crazy, but they still stole all your stuff and they got away with it. You're going to be pretty upset. You're going to buff up that alarm system. And so now when a dog goes to the bathroom in your yard or there's kids playing, your alarm system's going off, right? Like no one's breaking in again. Your alarm's really going off. You really have pain, but it's just the dog. It's just the kids. They're not actually breaking into your house. So your alarm system is going off, but it doesn't have to. That's exactly what happens. Let's say you develop chronic pain from stepping on that nail. The body healed, but your foot is tolerating a lot less pressure before it gives you really a lot of pain. So again, that just kind of feeds into that chronic pain cycle that we were talking about. So what to do when you have pain? So first and foremost, rule out red flags. With low back pain, 1% of the time, it is something very serious. It's a malignancy, a tumor, it's cancer. It is a disc that is bulging on your spinal cord and you need emergent care, right? But the red flags are usually pretty obvious things, but rule out red flags. And when in doubt, have it checked out. One thing I'll touch on is that pain is usually a pain problem, not a medical problem. Medical problem are things like cancer, like you need either surgery or chemotherapy or, any of those treatments, or, likely you would die. It's a heart attack. Like you need intervention with your heart attack or you will probably die. It's a stroke. And all those things usually require medication, physician management, sometimes surgery. Pain is usually a pain problem. Usually you don't need medications and you don't need that. And physical therapists are the experts at solving your pain problem and the experts at knowing those red flags and telling you when, hey, you need to get out of here and either go to the emergency department or see your physician because I think something more serious is going on. And when in doubt, we have it checked out. We refer you out. And for most insurances, you don't need a referral to see your physical therapist. You can just call and schedule directly, just like you would your primary care physician. And so our goal would be to be your primary care PT. So you have pain, first person you see is your PT, and then they kind of help guide you from there. The other benefit is that PTs typically do have, at least at our clinic, we have 45 minutes to spend with you as opposed to really the average that a primary care physician has is 6. I know there's definitely plenty that can spend more, but the literature shows the average time they have with the patient is about 6 minutes. So then we're going to go through these next 3 in more details. So here we go. So I don't know if you've heard of RICE, rest, ice, compress, elevate. Dr. Gabe Merkin, who coined that, he has actually since refuted it, saying that a certain amount of inflammation is good. And so I have created my own acronym called POP, which is pretty ironic if you had a pop with your injury. And so with POP, I think it encompasses RICE, but it also just gives you way more tools to improve as quickly as possible. I don't know if anyone here has had a total hip or know someone that has had a total hip. After surgery with a total hip, do you RICE it? Rest, ice, compress, elevate? Heck no. That PT is in there day of or next day making you walk on that thing because we know that the right amount of optimal load is helpful. So with that, first thing with POP is protect it, right? So when you have an injury, don't do things that could harm it. Is that total hip walking without a walker? Heck no. They're walking with a walker and then working to a cane and then from there. So if you feel like you sprained that ankle and walking on it is going to further bruise and injure it, or same thing with your knee, then throw a brace on it, crutch it. If you feel like you had a fracture, sling it, stabilize it, go seek help. So number 1, protect it. But then from there, do we want to rest? Usually not. We want to optimally load. So the day of or the next day with injury, you want to try to be as active as possible. The goal though is a little more every day. So if you're feeling pretty good and you do a ton more, sometimes later it flares up. And so you just want to do a little bit more every day. So with that, my rule is if you have pain while you're moving, that it's an acceptable level of pain. Meaning like, yeah, that hurts, but I'm okay with it. And then the biggest thing is not worse the next day. So like, yeah, that hurts, I'm okay with it. And do I think it'll be worse the next day? I don't think so. You might be wrong and it hurts worse the next day. Then you kind of take that and you do a little bit less next time, but you don't absolutely rest. What you want to avoid is this boom bust where you do a ton, you flare yourself up a ton, and then you have to absolutely rest. So that optimal load. The analogy I'll use for that is like Goldilocks. Not too hot, not too cold. Then we do want to pain manage. So usually with pain management, it's do the first two things well: protect it, optimally load it. Then from there, sure, ice or heat. So the one thing I don't want you to think is that you shouldn't ice anything. I just usually use it for pain management, like if it feels good to numb it, rather than getting my swelling down. We want a certain amount of inflammation and swelling. That's our body does it for a reason. It helps us heal. So we want a certain amount. And so I try to use compression and movement more than ice if I can. So that's our POP acronym that you'd really apply to any pain or injury. Then for me, I like to go with load tolerance and ability. So what the heck does that mean? Load tolerance, you want to consider the tissue healing. So oftentimes we will get protocols from physicians for surgery, which I totally respect and follow, and I don't do things that aren't on it. But I do consider within my box of where's the tissue healing. So I always want to know how far out they are from their surgery, and then what's the tissue quality and strength. And I do not want to load that tissue past its failure rate, because then it will fail, and none of us want that. So where is it in that healing process? Usually in the first 6 weeks, take it a little easier, and then you can kind of progress from there. And as you can see, our body responds to the loads placed upon it. So look at our my zooms in the bars in the area there. I think it's a 40-year-old triathlete, maybe it's 30-year-old, and the 70-year-old. Look at that muscle mass compared to the 74-year-old sedentary individual. And then I've seen a picture of this. I tried to look. There's also like a 35-year-old sedentary individual. Looks pretty similar to the 74-year-old. Now, what I want to encourage you at is if you're more towards that sedentary, you can improve and look more like the triathlete because the body responds to the loads placed upon it. And then abilities. So I don't care if you're 12 weeks out of an ACL surgery. If you can't load a single leg squat well and control your knee, I'm not letting you run. You have to have the ability to control it. So first, the tissue has to be able to load it, but then you have to have the ability to not overstress the tissue that hurt your ACL in the first place. So with that abilities, you have to have the ability to go through full range. So I'd want to see full depth squat, and then you have to have the strength to not let your knees dive in. So this is abilities in action. So this is Liv. She gave me permission to share this. And at this point, I think she was like 3 or 4 months out of ACL and owning it. A little bit of knee wobble there, but she recognizes it and she controls it. So that is abilities. So versus if that knee was diving in, then we wouldn't be thinking about running as much. So then long-term plan and maintenance. Woo-hoo-hoo. Cruise back through there. Great. Long-term plan and maintenance. So this kind of summarizes a little bit. So first thing long-term is hurt versus harm. Do I think I harm something or does it just hurt, not to downplay the pain? Use that POP recovery method. Then realistic expectations. With chronic pain stuff, so we always strive for no pain, but sometimes we can't get there. And I always ask people, if you had to pick having zero pain, but you couldn't do anything you wanted to do, versus you can do everything you want to, but you have pain, and sometimes significant, but it's in that acceptable level, what would you pick? And so joy with activities greater than pain is always what we strive for. And of course, we'll strive for no pain. Use it or lose it. The analogy I'll use is a savings account. So when my third kiddo was recently born, I definitely got off my routine with working out. What was cool though is as I got back into it, I noticed that I still had a lot of the strength. I lost some, but I still had a lot because I had been consistently saving over time. So the goal would be to try to be as consistent as you can over time. Take that vacation, just like you would with your finances. You spend a little bit of your savings, you get back, you build it back up. So use it or lose it. Body responds to the loads placed upon it. And then increase load tolerance and abilities. So muscles adapt and they protect joints. The more you challenge them, the more they change and get stronger and protect your body. And then full range of motion, and then being able to add more load through it. Remember all the 6 pillars of health. Obviously, I specialize in movement and exercise. If you notice, I put myself 6th, and I believe that's where it belongs. I think all those other things also factor in, but they're all important. And then the concept of live long and die fast. So that is a concept. There's actually been some commentary written about it in research, but basically the concept of staying strong and healthy and active, and then ultimately, we're all going to die at some point, but you have a nice long quality of life, and then something happens and you die fast, as opposed to over the years just less and less. A lot of older age sometimes is actually deconditioning. So yeah, we do have some things that get us older, but I do have a lot of patients that have a hard time getting up and off the floor, and that's from years of not doing it, usually because of pain, but we got to use it or lose it. So with that, I think that gets us to the summaries and takeaways. I feel like I just hit that pretty well. Just lastly, basically, pain is a pain problem. It's not a medical problem, except for those red flags that we talked about. It keeps wanting to pause there for some reason. And then chronic pain is a pain issue usually, not necessarily a tissue injury. Usually, there's some exceptions to that, like spinal cord injuries, etc. And then what to do when you have pain? Rule it out. When in doubt, check it out. Do the POP, do the load tolerance and activities, and then long term, there's a lot of things you can do to reduce your risk for future pain. So that is it. Resources wise, so physical therapy, we have ourselves. There's also lots of awesome physical therapists in town. And so we are the pain experts and can help you. If it's a medical problem, see your physician and we can help you. And then at Healing Motion, we do performance training. So we love to see people before they have pain or they're managing their nagging pain stuff. And then we don't have to spend any time calming down your pain. We just address those leaks in the boat, those flexibility and strength issues, and help you essentially avoid pain before it comes. And so that would be the game plan there, kind of like investing in your retirement. Lastly, I have hit y'all with a bunch of pain resources. So healingmotionpt.com/pain resources. On Instagram, if you hit our bio link, we have an education quick links. Pain resources is right there. And then I recently, even more than that picture, I added another resource. I created a pain education playlist with basically all the people I learned about pain stuff from. So maybe you should check out those videos more than listening to me, because they are the experts even more so than myself. So I hope that's all helpful. At Healing Motion, our mission is to move our community to excel in health, wellness, and life. And I really think that pain is a big problem in our society. And so we're happy to help any way we can, or reference you to resources that can. Here's some resources from the talk. And then, question time. Let me share. Sure. Maybe. Yeah. I mean, so you optimally loaded, right? You probably accepted a tolerable level of pain. You stayed as active as you could. If it was worse the next day, you probably backed off. If there was a specific exercise, you probably kind of dialed back a little bit. There might have been some hurt so good exercises that felt good even though they hurt, that you pushed through. You rocked and rolled. Anatomically, you probably strained your adductor. That goes all the way from your pelvis, all the way down your inner thigh. Some of them attached at the femur, some of them cross the knee. And so you probably strained it. The research is very clear, like time and time again, if you have a tendon issue, the people that do best are the people that load it. So when you take a control group that rests versus a group with Achilles tendon that appropriately works into some heel raise strength and stretching, the strengthening group wins every time. Now, are there outliers and sometimes people rest? Absolutely. But typically, so, is your optimal load sometimes closer towards laying off and it gets better? Sure. But usually it's the right amount of load. Another thing I'll use is all the time, I just recently saw a triathlete that was kind of struggling with some lingering foot and ankle pain way more than usual. And her movement pattern was such that she had a very hard time not letting those knees dive in on a squat, right? And had a little flatter arch, all of that kind of stuff. And it was a little bit of her bony anatomy that set her, but she'd been fine for years. And she was like, how have I been fine for years? And I just said, straw that broke the camel's back. Camel's doing fine. You're loading a bale of hay after bale of hay, no pain. That last straw, right? It hits that load tolerance of the tissue, boom. And then oftentimes that alarm system goes off and it makes you get better than you were as far as not loading it to kind of calm back down. So kind of long answer to your question, Shelly, but I think you optimally loaded it well. And I hope that kind of helps. Cool. So then we've got, going through the chat here. So Jen asked, if you feel a muscle pop or pain during workout, should you stop or keep going? Totally depends. I've got a great story of that. Probably 2 years ago, I was doing some kettlebell snatches in my garage, just as a home workout. And as I was going, I got a tweak in my back, and I was circuiting it out also with some deadlifts and some burpees and all that kind of stuff. And I was just like, man, that's just hurt. It's not harm, right? And I didn't feel a pop, but I could appreciate someone could have. So I pushed through, right? And I kept going. It's it kind of hurts, but I'm okay. and I pushed through. And the next day, any movement in bed was killing me, back all the way through my leg. Did optimal load, things hurt, but I kind of slowly went through. Went to work that day, was probably the best thing I could possibly do. Granted, my work, I'm up, down, moving around and everything. Gradually got better, totally reflared it up like 3 weeks later. I was at a PT conference up in Seattle. The group that I was doing is awesome, and we do workouts of the day as part of it because we got to be about it and practice what we preach. We did a bunch of crunches. Next day in class, my back was just reeling up again, right? And then the drive home was terrible. My legs cramping, like a bunch of nerve pain. And took me about 3 days longer. Same thing, going to work was the best thing I could do. Gradually got better and I recovered and I'm doing pretty well. But that would have been a pop that you kind of work through. So we have pops all the time, especially in the knees. It's usually like joints, gas bubbles, all that kind of stuff. Pops without pain, not a big deal at all. Pops with pain, I usually dial it back, probably like slow it down or shut it down, and then kind of see how it responds. And then the next day I kind of go through that pop process, protect it, optimally load it, gradually build up. But pops, usually if you're not like, usually if a pop totally tears something, like you literally can't weight bear on it, you can't lift your arm, etc. Usually if it's not a complete tear through, it hurts like heck, but you can kind of gradually load it. So what do you recommend if you have, this from Kim, what do you recommend if you have a knee or shoulder pain in regards to a brace maybe? Totally depends, right? So that brace can be in that protect it or that optimal load category. Also, if there's some swelling, getting some compression on it can help. So for me, if the brace helps me be more active and a little more active every day with less pain and less risk of aggravating the next day, you bet I'll brace it. And then I try to wean off of the brace as I feel like I'm improving. And usually I tell people, if you feel like you have to have a brace to do an activity, you probably shouldn't be doing the activity, and you should probably work on some things to build up to that. There's some exceptions to the rule though. I would always rather get my heart rate up than not. So, and then, sorry if I mispronounced this, Keisha. So heat or ice first for a sore injured muscle day one. Totally depends. So I put that in the pain management category. So for me, I would try to move. If a little massage feels good with like a stick roll or foam roll, a little bit of that, some gentle stretching, some gentle loading of some squats and stuff. I try to do all those things first. And then if pain is still there that is like distracting me, then I would try either. Personally, I usually try ice because it feels like it numbs it for me. Heat, it doesn't feel as good as for me, but it does for other people. So the answer is depends. Heat feels better, go for it. There's no research out there at all that shows that you're going to increase inflammation in a negative way from heat. That's just something that we say because it made sense in our heads at the time. But some inflammation is good. Personally, I would try to compress and do all the movement stuff before I ice or heat, just because we want some inflammation. But some is good. I also try to avoid ibuprofen. There is, when I'm acute, there is some research showing that it can delay healing because it's slowing down inflammation and we inflame to heal. So there's some research showing delayed bone healing and tendon healing. It's significant, but not a ton. So worst comes to worst, if you need the ibuprofen to manage some pain, go for it. But I try to avoid it if I can. I try to take like Tylenol first if I can, even though ibuprofen works better for me. So, and then, and again, sorry if I mispronounced names. Daisy, how do you know when you shouldn't continue working out? I'm afraid I will make it worse or go back in the healing process. For sure, when in doubt, don't, right? What I would say is, you said shouldn't continue working out. I bet you there are a bunch of modifications you could do in your workout to keep working out, right? If your ankle hurts on one side, man, crank like some single leg squats if you can, or some single leg deadlifts if you can, or some single leg heel raises. Get down and work some core stuff, work some upper body stuff where you're not loading that ankle. So really I like to think of, how do I know when I should modify my workouts as opposed to continue working out? Because the more active you can be, right, that's going to help all those other yellow flags, your stress, your confidence, all of that. Yeah, if you're afraid of making it worse, I would just dial it back and then basically do what you can where you're confident, and then the next day do a little more, and then the next day do a little more. And then Emily, what's the best way to stretch knee tendons if they get really tight and sore? So the analogy I use for that is, how many of you have gone on a hike or a run and you started and your calf was not tight, and you finished and your calf was tight. Probably a lot of us, right? Was your calf tight before the hike? No. So why is it tight? It didn't necessarily get tighter. It's just fatigued. And so a lot of times when we feel tight, it's actually that we're fatigued and tired, right? So what would be important is to check your quad length. I mean, if you can get basically like your heel to your butt and you can kind of tuck your pelvis under, probably not terribly tight. So stretching you can do if it feels good, but probably the biggest thing is to modify how much you're loading with like squats and all those activities loading the tendons. And it's probably an issue where as you get stronger over time, the tendons will be able to tolerate more, they'll get less sore, and probably be able to tolerate more. So I use stretching as if a muscle actually is tight as a strategy to increase length, but also as a strategy to manage pain. But I know that long term the need is a little bit more strength. So, and then Jamie said, not really a question, but I dealt with tendon pain and inflammation for years, and it wasn't until burn, optimal load, building strength that I finally made it pain-free. It took time, but resting, as I was told to do, originally left me in pain and swelling for years. Yeah, sometimes, we all saw the 6-week graph, right? So after you go after the 6 weeks, if rest still doesn't work, it's sometimes I pick my patient, but like, you've been resting for this long and you still have pain. How's that working out for you, right? So exactly, that optimal load is perfect. And again, that inflammation, there are some factors where we can have physical inflammation. Oftentimes the inflammation is the alarm system, right? It's the leaks in the boat, and whatnot. So sorry, I just lost my screen there. Megan, are we good on time? I guess people can leave as they want to. Okay, cool. So thanks for all those staying, and yeah, if you need to head out or whatever, bless my wife for taking care of our kiddos tonight, so that I don't have to do the bedtime tonight. But yeah, feel free to again follow us on social. We have tons of resources on there. KJ, any tips on dealing with mindset after injury? That's a good one. I know it's great to be mindful and accept where we are, but I struggle with this. Amen. I go ham during the workouts. KJ sounds awesome. And struggle with motivation when I get injured. I keep going and optimally load whatever area is injured for reference. Yeah, I mean, it sounds like you injure it well, and like that, man, try not to be a human, I guess, on that. Like, we're all going to be frustrated. So really, I think when that's the case, I go to that mindfulness, spirituality, faith base, and my relationships, and then sleep and stress management, nutrition. Like, those things are all key to help kind of rev down the system. And then just look for small wins, right? Like, look for the small wins of, if let's say again the legs hurt, can you PR on pull-ups, right? Can you PR on, I don't know, V-ups in a minute or something like that, right? So look for the small wins of the things that you can do, and then keep working on that optimal load. And there's a graph that shows this is what I think rehab and recovery will be, and it's like this awesome line, and it's like this is what it really is, all over the place, but ultimately you end up in the same spot. But it's a lot of those ups and downs, and yeah, pretty much welcome to being human on that. Heather, is it okay to wear wrist braces to prevent overextending during a workout, or is it better to try without to build up the muscles and tolerance? Awesome question. Answer is it depends. So I would say, like, if you want to do burpees and your wrists have classically hurt you, probably throw your wrist braces on so you can do the dang burpees, right? But then with that, try to work on like elevated push-up. And at first something, if you can do like a barbell or something where you can be like a neutral wrist as opposed to an extended wrist, work on that. Work on some dumbbell push-ups as you get more to the ground. And then first start working some stuff like a up dog, like chaturanga, down dog, chaturanga to up dog. Some stuff to start working some wrists, work like some leopard crawls or some bear crawls. And then slowly work into some push-ups with wrists there. You can put like a folded towel under your palm so you're not quite as extended, and slowly build that tolerance. And a year later, you're doing burpees with no braces. So that'd be my recommendation there. And also, I just say don't accept things of like, oh, like I'm always gonna have to wear wrist braces, or I tried it for a year and I couldn't. Did you see a PT or movement expert? And then even if you did, like sometimes we miss it. Like I've had patients that I wish I could have back that I missed their assessment. I wish I could have it back and do it better the next time. So if that PT didn't work out, try another one in that company or try someone else. And then for those of us on the older end of things, any tips for more arthritis related chronic pain? Yeah, so keep moving. So arthritis is a catch-22 where movement hurts it, but movement's what's best for it. So you really got to find that optimal load. There was a great study they did with runners, and basically rec runners who ran for their whole life, 3% rate of knee arthritis compared to the sedentary population at 10%. And then ultra marathoners that ran more than 55 miles a week had 13%, so only 3% more than the sedentary, but I bet you their hearts were pretty healthy. So yeah, keep moving, find out what works for you. Another thing, people respond to different things. Burn and hit style is awesome and great. It's not for everybody, right? Yoga is great. For me, sometimes I get a little bored and I want to load more and I want to pick up heavy things. That's just me. So find what works for you and just keep moving. And so that would be the biggest thing. I would say, again, with that, remember the wrinkles on the inside, right? So just because an image said you had arthritis doesn't necessarily mean you have to have pain. So just kind of keep moving in the right way. So there's that. Cool, and everybody thanking Tracy for helping out with the kiddos. I love it. Cool. Any other questions or anything at all? Cool. Thank you. Well, I appreciate all your time and attention. Please go ahead, Megan. Oh, there it is. Oh, absolutely. It's okay to use massage guns. You bet, Heather. So again, people respond differently. So I find, sorry, you got me off on another tangent. So when you get a manipulation or an adjustment, what happens? Well, there's zero research to my knowledge other than case studies that show that your vertebra was like this, and then you got an adjustment, and then it's like that. Like zero, other than maybe some case studies. What we do know, and the literature is clear, is that when you have a joint cracked, that the pain centers in your brain, it feels good, right? Like we love it. And so it's the pain centers that decrease. It also shows that your multifidi muscles pump up and your pain to pressure is less and all that kind of stuff. So all that to be said, some of us respond really well to having a joint cracked, which PTs can do, by the way, but I do refer to chiropractors when I feel like their skill set would fit it better, and we co-treat. So massage gun. Some people respond great to massage guns. Feels good, loosens you up, you feel like your stretching is more effective afterwards. Awesome. Some people respond to foam roller. Some people respond to deep tissue massage. Some people, deep tissue massage kills them and they gotta go light. Some people swear by acupuncture. Some people swear by Reiki, which is usually not laying your hands on, but you're just doing energy stuff. Man, whatever floats your boat but works and helps you feel better with less pain and move more and get your heart rate up, love it. Go for it. They did do a study on the IT band with a cadaver. They hung 2 tons, maybe it was 1 ton, 1 or 2 tons from it. They made a 1% length change. So if you think you're gonna stretch out your IT band with a massage gun or foam rolling, good luck. But you can get the quad moving a little bit better in front and behind. You can feel better with your stretching, and you can make some length changes of the quad with it. And so again, whatever helps you have more range of motion, less pain. If it's a massage gun, love it. If it's a foam roller, love it. If it's mostly strengthening to lengthening, love it. So, and then social media links. Yeah, so what I will do, they're all on our website. So I will just copy and paste our website real quick. Bada bing, bada boom. And I will throw that in the chat. Oh, that's the Megan. There we go. Boom. So all of our social is on there. The pain resources are on there and everything. And then that was mostly it. And then really just, shameless plug, screen share. I meant to do this earlier. So our website is just here, built it ourselves, patient center, education quick links. Oops, wrong thing. Education quick links. Should load. Review us, follow us on social, pain resources, hard to push with exercise, 6 pillars of health, our YouTube channel, and then our blog, which has all sorts of stuff. And My vision is much bigger for this than we have. So eventually we will have much more resources on here and YouTube videos than we already have. But there is only so much time in the day, and I like hanging out with my family. So anything else? Cool. Well, thank you. I appreciate all of your time and attention. If you have any questions, email is just dane@healingmotionpt.com. Shoot me an email at any time. You can Facebook me. And yeah, ultimately, kind of one last soapbox. We recently commemorated 500,000 people dying from COVID-19, and that is absolutely terrible. The reality is every year, about November 1st, we have hit 500,000 deaths from heart attacks alone. You had strokes on there, it's like 650,000. You had type 2 diabetes on there, jumps up to 750,000. And with the heart attack stuff, 80% of those are preventable. So not all of them, but 80%. We as a society need to keep our heart moving because it's preventable if we just move and find what works for you. If it's burn, I love it. If it's going on a walk, I love it. Just keep moving, and please don't ever let pain make you not move. Try to find a solution, and it's a hard road, and it's really hard for some, but it's doable. And then cancer, 600,000 people die a year from cancer. But if you're as fit as possible going into that treatment, you have the best shot for quality of life during it as best as possible and having your best fighting shot. So whatever brings you joy with movement, keep it going, keep your heart pumping. Cool. Awesome. Thanks, y'all. Appreciate it.